or something along those lines. But there are clinics that will do that. But that's not something we're doing here.
Yeah.
So for our uses here, it is covered by insurance. And again, we're going to make certain that your coverage is in place before we put you into the chamber.
Yeah, yeah. How do you get your patients then? Are they referred by a family physician or even a surgeon?
Most of our, actually, both. A lot of our patients are referred mostly by family physicians who are dealing with ulcers. They try to deal with them themselves, notice that it's just not healing or it's gotten worse, so they refer them to us. And believe it or not, a lot of our patients come from word of mouth. So patients come in, they get healed, they go out, they tell their friends, hey, you need to go to there. And so they'll come to us and we'll get them started on their proper
Now,
healing.
would that mostly be a patient that has a wound that hasn't healed and he's fed up with going to the family physician?
I wouldn't say fed up, but,
No, okay, but he's looking for
but they're looking for
an alternative
ways,
treatment.
alternative treatments to get it healed. So, especially if we've had wounds that come in been worked on for 3 years at a time, and then they come in and within not even 6 months, within 3 months we'll have them healed.
So people let things go for 3 years or so.
Correct.
That's unbelievable. And of course you do work fully with their family physician in cases like that.
Absolutely. If they want to refer them to us, we usually give them a report right back about how the patient's doing. And when they're actually healed, I send a personal report to them saying, this is what happened, this is what needs to be done from here on out.
So does that make you get more referrals from physicians? I mean, where you know they could work on it for a year or so, or they could send them to the wound healing center and get it taken care of.
And actually, in today's world, the primary care physicians are in such we just don't have enough primary care physicians. And we don't want them necessarily spending the time that it takes to do wound care in their office. Plus, there's a lot of products that you have to have available on hand, so the overhead is very high as well. So it really makes more sense to send them to us, allow us to care for that wound. We'll keep the primary care physician fully involved with their care. You know, for instance, if a diabetic were to come in and say that they've had to make some changes to their insulin dose because of finger stick blood sugars, we're not there to address that. Rather, what's going to happen is we're going to call their family physician and notify them of those changes and ask whether or not the family physician would like to see them or make an appointment while the patient is actually there at the wound care center. So we work hand in hand with the primary care physician to make certain that all of the care for the patient is taken care of.
Yeah, yeah. You don't want to make any physicians mad in the area.
No.
I mean, overstepping your bounds.
That's exactly right. We walk into the clinic, even though we're looking at the patient from a holistic viewpoint, our goal is to only look at the wound and treat what is going on with that wound. We're going to leave the rest of the care to the family doc or to the internal med doc, whoever it is that sent the patient in.
Right, right. You know what we haven't come up with is where are you located? You're in the hospital?
Technically we're in the hospital, attached to the hospital.
That's right. We're at 210 Sharon Road. We're in
Okay.
the Professional Arts Building, right behind the hospital. If people are familiar with where the eye center or the hearing center is, we're in that same building. And we're on the first floor in Suite 2.
And a phone number? If they want to get in contact with you?
Phone number, I'm going to give them my phone number. How's that sound?
Cell number?
No, I'm gonna, we're gonna give them the local phone number, and the local phone number is 420-8337, and again that's 420-8337, and they can get in touch with us, and we'll be glad to set them up with one of our expertly prepared panel physicians.
Yeah. And how often are you in the wound healing center? Is that a 7 day a week?
No, we're open 5 days a week.
Okay.
Obviously, if there's conditions that occur outside of that, we always have them go to the emergency room in case of emergencies. But we have panel physicians that are on staff for 4 days of those weeks, and then 5th day, if we need someone to come in, someone will be there.
Yeah. We're about out of time. What haven't we mentioned that the community needs to know?
I think it's just important that for those listeners to make certain that if they have friends or family in the area who would they think might benefit from any course of wound healing, that they get in touch with us. And the earlier the better. As Dr. Nunley said, we oftentimes have patients that have gone for years and just kind of tolerated a wound, as it were. Mm-hmm. And there's no reason necessarily to have to do that. So we would ask that your listeners, look around, see who might benefit from wound healing, and give us a call. Yeah. We'll be glad to take a look and see what we can do to help them out.
All right. I had another question. What was that? Oh, brain freeze. Oh, well. This has been another exciting edition of Berger Beat, talking about the hyperbaric oxygen therapy at the Wound Healing Center at Berger Hospital. I want to thank Mark Kemp, RN, and he's the program director. And again, thank you very much for coming in, Dr. Ian Nunley. He's a general surgeon and the medical director of the Wound Healing Center at Berger Hospital. So thanks for listening, and we will talk to you on Berger Beat next month. Thanks.